Hello and welcome to the Tip of the Week. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. So this week I want to talk to everybody about a physical exam, what it entails, and the difference between a physical exam and a vaccine exam, and why your pet needs physical exams even if they don't need vaccines. So basically, a physical exam means that we are looking at every part of your animal's body externally. So obviously it may not include blood work, although that is important in some situations, or it may not include more detailed things like x-rays and ultrasounds, although again at some situations that is important. But a physical exam is just us looking at the outside. So we typically start with the head. We look at the eyes, we look at the nose, we look at the gums and the teeth, and see if there's any dental problems, or if there's any injuries or gingivitis or anything like that. We look at the ears. We're looking for eye infections, nasal discharge, mouth problems, ear infections, any masses that we might find. We're also feeling the lymph nodes. A lot of times as an owner aspect, it may look like we're just kind of petting and massaging your pet, but we're actually, as we're talking to you, we're actually feeling all the lymph nodes in the various areas. So there's lymph nodes underneath the chin, just like in us, in the throat area. There's also lymph nodes in the armpits and in the groin, as well as behind the knees and deep inside the belly. And so we're feeling a lot of those that are external and that we can feel to see if there's any swelling or enlargement. We're also listening to the heart and the lungs, and we're taking vitals, meaning that we're taking a heart rate, a respiratory rate, and a temperature. We're feeling the abdomen to feel for any pain, discomfort, feel the size of the kidneys, feel if there's any masses or enlargement in any organs or decrease in size in any organs. We're feeling usually along the spine and the legs, and looking at the skin, looking for any problems as far as lumps, bumps, infections, rashes, anything like that. Looking at the genitals. And so we're basically just doing a full physical exam, just like when you or your child goes to the doctor. If it is a physical exam, it means that you're bringing your pet in for something more serious. A wellness exam, or what we call a vaccine exam, is simply that. It means that your pet is well, there's no concerns, everything is healthy and going well, and you're just here for your annual checkup with vaccines. That's a much more mild situation. We still look at all those things, but because there's not an actual illness or injury or problem going on, it takes a little bit less time. A lot of our technicians are extremely skilled in doing this as well, and then they can pass on information to the veterinarians if there's any problem that they see. So a vaccine exam is a more precursory, smaller exam, still looking at the same things, but not quite as in-depth because there's no concerns going on. The pet's basically healthy. Why do you need exams regardless if your pet needs vaccines or not? As I've mentioned before in other videos, pets do age quicker than we do. And so if you're doing a physical exam every 6 months or a year on your pet, that's like us getting a physical exam every 6 years to 12 years on us, which can be a long time. And so it's important, the little things can come up. A lot of times we can catch things that you may not have noticed. For example, last week I had a pet come in just for a simple wellness exam, and I was taking a look at it and I found a mass on the thyroid, and that's something that the owner had never noticed. And so things like that are important to check. So it's important that you do get your pet checked by either a technician or a veterinarian for things like dental disease and stuff like that, and we can let you know if there's any concerns and if there's anything else that needs to happen. Also, in your older pets, it's really important that you're doing more deep examinations such as blood work and x-rays. A lot of times we can catch things such as lung problems if we're doing those annual every 6-month x-rays, and those are things that you might not notice until it's too late. A lot of times from the outside you can't hear or tell problems until it's pretty severe. Also, in your younger pets, really important that we're checking, to make sure that they're ready to get spayed and things like that. And then it's a very good idea, I would say essential to do on your pets every single year is to get a fecal test and a heartworm test. And basically what that means is we're checking the poop, which is a fecal test, once a year to make sure that they don't have any parasites that are being contracted on the ground or from you carrying things in on your shoes. A lot of those parasites can be passed to humans, so you want to keep the whole family healthy. And we're doing the heartworm check to make sure that they haven't picked up any heartworms from the mosquitoes that is deadly and is very easily prevented. So preventative care, like always, is extremely important. It's very sad to us when we see pets that either die or are very sick, or owners have to spend a lot of money on treating a disease that is 100% preventable. And if we just do the preventive, then we can take better care of our pets and keep them happier and healthier for a longer period of time with us, which is ultimately what we want. So if you have any further questions, or if you're just curious, please give us a call. We're more than happy to talk to you about it. Bring your pet in, we'll do a physical exam. If you're wondering what we're looking at, we're more than happy to talk it through with you. You know, we can say, okay, so here we're looking at these lymph nodes, they're fine, etc. And that involves you guys a little bit more as well. If you have any questions, let us know. Otherwise, have a great week, and thank you for tuning in. Bye-bye.